What is BPH, benign prostatic hyperplasia? Are you waking up multiple times during the night just to urinate? Do you constantly feel like you can't fully empty your bladder? Is your urine stream weaker than it used to be? These are not just annoyances. They could be signs of something more common than you think. It's called BPH, benign prostatic hyperplasia, also known as an enlarged prostate. Let's break that down. Benign means it's not cancerous. Prostatic refers to the prostate gland. And hyperplasia means abnormal growth. So together, BPH is the non-cancerous enlargement of the prostate gland. It's one of the most common conditions affecting men as they age. In fact, over 50% of men above age 50 have signs of BPH. And by the time you reach 80, there's nearly a 90% chance you'll have it. But what exactly is the prostate? And why does it matter? The prostate is a small walnut-sized gland located just below the bladder. Its main job is to help produce seminal fluid. That's the fluid that carries sperm during ejaculation. But here's the thing. The urethra, the tube that carries urine from the bladder to the outside of your body, passes right through the prostate. As the prostate grows larger, it can start to squeeze or partially block the urethra. That's where the problems begin. Let's talk symptoms. Some of the most common signs of BPH include difficulty starting to urinate, a weak or interrupted urine stream, frequent urination especially at night, a sudden or urgent need to urinate, feeling like your bladder never fully empties, and in some cases the complete inability to urinate, known as urinary retention. For many men, these symptoms can come on gradually. You may ignore them at first. You might think it's just part of getting older. But over time, they can seriously disrupt your quality of life. Imagine this. You're getting up 3 or 4 times a night just to pee. You're tired during the day. You avoid long road trips or social events out of fear you won't find a bathroom in time. Or worse, you feel embarrassed when you can't hold it in. BPH is not life-threatening, but it is life-altering. Now you might be wondering, why does the prostate start growing in the first place? That's a great question, and we'll get into the biological causes in the next part. But for now, here's what you need to know. BPH is incredibly common. It affects millions of men around the world. And while it's not dangerous in the way cancer is, it does deserve attention. Because left unmanaged, BPH can lead to complications like bladder damage, kidney problems, infections, and severe urinary retention that may require a catheter or even surgery. The good news? You don't have to suffer in silence. There are natural solutions. There are lifestyle changes. And there are proven ways to get your life and your bladder back under control. In this video, we're going to explore all of that. But first, it's important to understand the root cause. Why does your prostate keep growing as you age? What's happening inside your body to trigger this change? And most importantly, what can you do about it? Stick around. Because if you're over 50, or even approaching it, this could be the most important information you hear all year. Let's move on to the next section, where we dive into why the prostate grows and the hidden role of hormones in BPH. Why does the prostate enlarge? The hidden role of hormones. So now we know what BPH is. But the question remains. Why does the prostate start to grow in the first place? The answer lies in your hormones. More specifically, male sex hormones like testosterone and DHT. Let's take a closer look. Testosterone is the primary male hormone. It's what gives men their deeper voices. It supports facial hair growth, muscle development, and sex drive. It plays a huge role in our physical identity. But as we age, something interesting happens. Our levels of testosterone start to decline. This is completely normal. It happens to all men. However, not all testosterone disappears. A portion of it gets converted into another hormone. This hormone is called DHT or dihydrotestosterone. DHT is much more potent than testosterone, and it's created through an enzyme called 5-alpha reductase. Think of this enzyme like a switch. It turns regular testosterone into a more intense, more powerful form, DHT. Now here's where things get complicated. As men get older, 5-alpha reductase becomes more active. That means more testosterone is being converted into DHT. And while DHT is useful for certain functions, like developing male characteristics during puberty, having too much of it in adulthood can cause problems. One of the main places DHT goes to work? The prostate gland. Excess DHT binds to androgen receptors in prostate tissue. This stimulates the cells to grow and multiply. Over time, this causes the prostate to gradually enlarge. The result? Benign prostatic hyperplasia. But that's not the only effect of too much DHT. It also affects your hair. DHT has been shown to shrink hair follicles, especially on the scalp. That's why high DHT levels are strongly linked to male pattern baldness. So to summarize, testosterone naturally decreases with age. More of it gets converted into DHT. DHT causes the prostate to grow, and it contributes to hair loss. Now you might be thinking, isn't there a way to stop this conversion? Yes, there is. In fact, many prescription medications for BPH are designed to do exactly that. They're called 5-alpha reductase inhibitors. You may have heard of them. Drugs like finasteride and dutasteride. These medications work by blocking the enzyme that turns testosterone into DHT. Less DHT equals less prostate growth. But like most pharmaceuticals, these drugs come with side effects. Some men experience decreased libido, erectile dysfunction, mood changes, and other hormonal imbalances. That's why many people look for natural alternatives. And yes, some herbs and nutrients may help inhibit the same enzyme without the harsh side effects. We'll get into those later. But first, let's go back to the basics. You may be wondering, if testosterone is the male hormone and I'm losing it, shouldn't I want more testosterone, not less? It's a great question. Here's the key. It's not just about how much testosterone you have. It's about what your body does with it. If too much of it is being turned into DHT, you may be getting the worst of both worlds, low testosterone and high DHT. That's why the balance between testosterone and DHT is so important. Too little testosterone leads to fatigue, low sex drive, and depression. Too much DHT leads to BPH and hair loss. Finding the right hormonal balance is essential for male health. And the good news? There are ways to support that balance naturally. We'll talk more about that in upcoming sections. But before we move on, let's quickly recap. The prostate grows because of hormonal changes, especially increased DHT. DHT is created when testosterone is converted by 5-alpha reductase. Too much DHT overstimulates prostate growth. It also leads to thinning hair and baldness. Pharmaceutical drugs block this conversion, but can have unwanted side effects. Natural solutions may offer support, without disrupting your entire hormone system. Understanding this hormonal connection is the first step in managing BPH. Once you see what's happening behind the scenes, you can make smarter choices, both with your doctor and in your everyday lifestyle. In the next section, we'll explore one of the most powerful natural tools we have. A vitamin that plays a critical role in hormone regulation, inflammation control, and yes, even shrinking the prostate. That vitamin is vitamin D. So stick with us, because what you're about to learn might just change your life. The critical role of vitamin D in treating BPH. Now that we understand how hormones drive prostate enlargement, let's talk about something that might surprise you. A simple, everyday vitamin could make a big difference. I'm talking about vitamin D. You might already know vitamin D as the sunshine vitamin. It's produced when your skin is exposed to sunlight. It supports strong bones and a healthy immune system. But here's the secret many men don't know. Vitamin D also plays a vital role in prostate health. Vitamin D in aging men. Vitamin D is a fat-soluble vitamin. That means it needs dietary fat to be absorbed by your body. And as we age, our ability to produce vitamin D naturally declines. Older men tend to spend less time in the sun. And even if they do, their skin doesn't convert sunlight into vitamin D as efficiently. The result? Vitamin D deficiency is extremely common in men over 50. And studies are showing a strong connection between low vitamin D levels and BPH. What the research says. Research has found that men with vitamin D deficiency are more likely to develop an enlarged prostate. One particular study revealed something groundbreaking. When BPH patients supplemented with 6,000 IU of vitamin D per day, their prostate size actually decreased over time. Think about that for a moment. A simple vitamin supplement could shrink the prostate. Not just slow it down, shrink it. And the benefits don't stop there. Vitamin D supplementation has been shown to reduce nighttime urination frequency, improve urinary flow and strength, decrease that constant nagging feeling that your bladder is never empty. It's a natural way to address the root of the problem, not just mask the symptoms. Why vitamin D works for BPH. So why is vitamin D so powerful for prostate health? For starters, vitamin D acts as a natural anti-inflammatory. Chronic inflammation is one of the key drivers of prostate enlargement. Vitamin D helps calm down this inflammation. It reduces swelling, improves circulation, and promotes healthy tissue function. Vitamin D also influences hormone regulation. It may help balance the relationship between testosterone and DHT. That means less stimulation for the prostate to grow. How much vitamin D do you need? This is where many people get confused. The standard recommendations of 600 to 800 IU per day are way too low, especially for older adults dealing with deficiencies. For men concerned about prostate health, a starting dose of 2,000 IU per day is often recommended. But here's the catch. Everyone absorbs vitamin D differently. Two men could take the same dose and end up with completely different blood levels. That's why testing your vitamin D levels is crucial. Personally, many health experts, including Dr. Alan Mandel, take around 5,000 IU per day. This keeps their blood levels in the healthy range of 50 to 60 nanograms per milliliter. If you decide to supplement, start with 2,000 IU per day. After a couple of months, get a blood test to see where you stand. Then adjust your dosage if needed. How to take vitamin D correctly. There's another important point. Because vitamin D is fat-soluble, you should always take it with a meal that contains healthy fats. If you take it on an empty stomach, you won't absorb nearly as much. Good sources of healthy fat include avocado, olive oil, nuts and seeds, fatty fish like salmon. Taking vitamin D with these foods ensures maximum absorption. A word of caution. More is not always better. While 5,000 or even 6,000 IU can be beneficial, megadoses of vitamin D can cause toxicity if taken recklessly. This is why blood testing is non-negotiable. Aim to keep your blood levels between 40 and 60 nanograms per milliliter for optimal health. Anything above 100 nanograms per milliliter could be harmful. The bigger picture. It's important to remember that vitamin D is not a magic pill. It works best when combined with a healthy diet, regular exercise, stress reduction, and pelvic floor stretches, which we'll talk about later. But make no mistake, getting your vitamin D levels up can transform your prostate health. Imagine sleeping through the night without having to get up 4 times to pee. Imagine feeling like your bladder is finally under control. That's the power of optimizing vitamin D. Transition to the next step. So, if you haven't tested your vitamin D levels yet, this is your sign to start. A simple blood test could reveal one of the biggest missing links in your health. In the next section, we'll explore other natural remedies. Things like zinc, saw palmetto, and beta-sitosterol, which have all been shown to support prostate health. But first, take this to heart. Vitamin D isn't just for bones and immune health. It could be the missing key to reducing BPH symptoms and improving your quality of life. Misdiagnosing BPH, the hidden truth about CPPS. So far we've talked about BPH, what it is, why it happens, and how something as simple as vitamin D can help manage it. But now we need to look at something else. Something that looks like BPH, feels like BPH, but isn't BPH at all. It's called CPPS, chronic pelvic pain syndrome. And it's one of the most overlooked and misdiagnosed conditions in men's health. What is CPPS? CPPS stands for chronic pelvic pain syndrome. It's a condition that causes pain, pressure, and discomfort in the lower pelvic region. The symptoms can be very similar to those of BPH. Things like difficulty urinating, feeling like you didn't empty your bladder, pressure in the rectal or prostate area, a frequent need to urinate, especially at night, even sexual dysfunction. Sounds familiar, right? That's why many men, and even doctors, mistake CPPS for BPH. But here's the difference. BPH is a physical enlargement of the prostate. CPPS, on the other hand, is a muscular and neurological issue. There is no enlargement of the prostate. There is no infection. But the symptoms are just as real. What causes CPPS? There's no single cause. But several factors can contribute to it. Let's break them down. Sitting for long hours, especially with poor posture. Weak core muscles and poor abdominal strength. Obesity and excess belly fat that puts pressure on the pelvic floor. Repetitive strain or trauma to the pelvic area, like bike riding, sports injuries, or accidents. Habitual tension in the lower body, clenching, stress, or even subconscious muscle tightening. Over time, these factors create an imbalance in the muscles of the pelvic floor. When those muscles become tight, weak, or misaligned, they create trigger points. These trigger points refer pain to surrounding areas, including the prostate, the rectum, the bladder, and even the penis. This is why so many men believe they have an inflamed or infected prostate, when in fact it's a muscular imbalance causing the problem. Why doctors get it wrong? This is where things get frustrating. A man walks into the clinic. He says he's having urinary symptoms. The doctor does a quick exam. Maybe runs a urine test. If there's no clear infection, the doctor often says, "Let's just give you antibiotics, just in case." Or worse, he assumes it's prostatitis, a bacterial infection. So the patient goes home. He takes the antibiotics. Maybe even takes multiple rounds. But nothing gets better. Because there's no bacteria to kill. The problem was never an infection. This is how millions of men are misdiagnosed with chronic prostatitis, when what they really have is non-bacterial CPPS. The antibiotic trap. Here's the truth. If your urine culture is clean, and you're still being given antibiotics, you're not being treated, you're being pacified. Antibiotics won't relax tight pelvic muscles. They won't fix poor posture. They won't resolve pelvic trauma. And they definitely won't balance your core strength. So what happens next? The patient gets discouraged. He loses trust in doctors. And worst of all, he continues to suffer silently. What actually helps CPPS? Here's the good news. You don't need more antibiotics. You need a new approach. Treatment for CPPS often includes pelvic floor physical therapy, stretching exercises focused on the lower pelvis, deep breathing and stress relief to reduce muscular tension, correcting posture and avoiding prolonged sitting, targeted core strengthening to support the pelvic region. One of the simplest things you can try today? Pelvic floor stretches. We'll talk more about them in an upcoming section. But trust me, just 5 minutes a day of the right stretches can do more than a month of antibiotics ever will. Why this matters? If you've been suffering from symptoms that feel like BPH, but your medications haven't helped, your tests come back normal, and you're still uncomfortable, you might be dealing with CPPS instead. The solution is not in another pill. It's in releasing the tension, balancing the muscles, and restoring alignment. This is a message too many men never hear. And as a result, they go untreated for years. Let this be your turning point. There is help. There is hope. And your healing starts with understanding what's really going on. In the next section, we'll cover some powerful natural remedies, from saw palmetto to zinc, that can work together with stretching and lifestyle changes to finally bring you relief. But remember this: not all urinary issues come from BPH. And not all prostatitis is bacterial. Sometimes the real problem lies in the pelvic floor muscles. And the answer isn't another prescription. It's restoring balance to your body. Natural remedies for supporting prostate health. If you've made it this far, you already know that BPH is a hormonal condition. You also understand that many men are misdiagnosed, and that lifestyle changes, like stretching and posture, can make a huge difference. But let's talk about something else. Something simple. Something that comes from nature. Let's talk about natural supplements. Because while medications can help in some cases, they often come with unwanted side effects. Fatigue, low libido, erectile dysfunction. Natural supplements offer a gentler, more balanced approach. And they've helped millions of men manage BPH symptoms without disrupting their lives. Let's walk through the most powerful ones. 1. Beta-sitosterol. Beta-sitosterol is a plant compound found in fruits, vegetables, seeds, and nuts. It belongs to a group called phytosterols. Research shows that beta-sitosterol can help improve urine flow, reduce the amount of urine left in the bladder, decrease nighttime urination. It works by reducing inflammation and possibly blocking DHT activity, the same hormone that fuels prostate growth. And the best part? It's well tolerated and has very few side effects. Many natural prostate supplements list beta-sitosterol as a primary ingredient. And for good reason, it works. 2. Saw Palmetto. Saw Palmetto is one of the most popular herbal remedies for prostate health. It's made from the berries of a palm plant native to North America. Studies show that saw palmetto may help slow down prostate growth, improve urinary symptoms, support hormone balance by blocking 5-alpha reductase, the enzyme that turns testosterone into DHT. It's basically a natural alternative to medications like finasteride, without the harsh side effects. When taken consistently, many men report noticeable improvements in just a few weeks. 3. Pygeum, African plum bark. Pygeum comes from the bark of the African plum tree. It's been used for centuries to treat urinary problems. It works by reducing inflammation in the prostate and bladder. It may also improve seminal fluid quality and reduce pain during urination. It's especially helpful for men with frequent nighttime urination, men who feel constant pressure in the pelvic area. Pygeum is often combined with other herbs and prostate formulas for maximum effect. 4. Ryegrass pollen extract. Ryegrass pollen extract is made from the pollen of 3 types of grasses: rye, timothy, and corn. It has been shown to relax the muscles around the urethra, improve urine flow, reduce inflammation. It's particularly useful for men with mild to moderate BPH. And it may also help reduce the pain and discomfort often associated with CPPS. Many men who don't respond well to traditional medications find ryegrass to be a powerful natural solution. 5. Lupin extract. Lupin is a flowering plant whose extract may help block DHT production. It works similarly to saw palmetto and beta-sitosterol, though it's less well known. Early research and anecdotal reports show promise. Lupin is especially effective when combined with other herbs. It works best as part of a comprehensive supplement blend. 6. Zinc, the prostate's favorite mineral. Zinc is essential for prostate health. In fact, the highest concentration of zinc in a man's body is stored in the prostate gland. Zinc helps regulate testosterone, prevent prostate cell overgrowth, support immune function. Zinc deficiency is surprisingly common, especially in older men or those with poor diets. Adding a zinc supplement or eating more zinc-rich foods, like pumpkin seeds, lentils, or beef, can make a big difference. It's a small mineral with a big impact. 7. Vitamin C, not just for colds. You've heard of vitamin C for your immune system. But did you know it's also good for your prostate? Vitamin C acts as an antioxidant, helping to reduce oxidative stress and chronic inflammation, two factors that contribute to prostate enlargement. It also supports collagen production, which helps maintain healthy tissue in the urinary tract. While not a direct treatment for BPH, vitamin C can support the overall healing process, especially when taken alongside other supplements. Combination formulas, power and synergy. The best part? You don't need to take each of these individually. Most natural prostate supplements combine several of these ingredients into one formula. A good blend might include beta-sitosterol, saw palmetto, pygeum, plus additional support from ryegrass or vitamin C. These ingredients work together to reduce symptoms, improve urination and support long-term prostate health. Look for formulas that are clinically tested, transparent about ingredient amounts, free from fillers and artificial chemicals, a gentle yet powerful path. Natural remedies may not work overnight, but over time they can lead to real, lasting relief, without the side effects of prescription drugs. They're especially effective when combined with proper nutrition, stretching and pelvic floor exercises, adequate sleep and hydration, and vitamin D supplementation. Remember, nature provides what the body needs to heal. We just have to give it the right tools. In the next section, we'll show you how daily stretches and posture correction can reduce pressure on the prostate. And maybe the final piece you've been missing: lifestyle changes and exercises that support prostate health. Taking supplements is a powerful step, but if you truly want lasting results, you need to look at how you live every single day, because certain habits and behaviors may be silently working against your prostate health. Let's talk about those now. Habits to avoid. First, let's go over a few lifestyle habits that can worsen BPH symptoms over time. Eating too much sugar and processed food. High-sugar diets increase inflammation in the body. Processed foods are often filled with chemicals, bad fats, and low-quality ingredients. All of this puts extra stress on the prostate and the urinary system. Lack of sleep. Poor sleep affects your hormone levels, immunity, and recovery. Your body repairs itself during deep sleep. Without it, inflammation builds up, and prostate symptoms can get worse. Sitting too much. Long hours of sitting, especially on hard surfaces or small seats, puts pressure directly on your pelvic floor. This compresses blood flow, tightens muscles, and increases discomfort in the prostate area. Frequent biking. Long cycling sessions, especially without proper seat support, can irritate the prostate. If you bike often, consider using a wide, padded seat or reducing ride time. Not moving enough. Physical inactivity leads to poor circulation and weak pelvic muscles, both of which contribute to BPH and pelvic pain. Changing these habits is step one. But let's talk about something even more powerful. Pelvic floor stretches, a game changer. If you've never heard of pelvic floor stretches, don't worry. Most men haven't. But these gentle movements may be the missing key to relieving pressure on your prostate. Your pelvic floor is a group of muscles that support your bladder, bowel, and prostate. When these muscles are tight, weak, or imbalanced, they can cause urinary urgency, a feeling of incomplete emptying, pressure or pain in the pelvic region. By releasing and strengthening these muscles, you can significantly improve your symptoms, naturally. The best part? You don't need any equipment. You can do these exercises at home. And just a few minutes a day can lead to noticeable results. Recommended stretches. Here are 3 simple stretches to get started. Frog stretch. Kneel on the floor and slowly spread your knees apart, keeping your feet behind you. Rest on your forearms or hands. This opens the hips and stretches the pelvic floor. Butterfly stretch. Sit on the floor with the soles of your feet together. Let your knees drop to the sides. Gently press down for a deeper stretch. This helps loosen the inner thighs and pelvic region. Knee to chest opener. Lie on your back. Pull both knees toward your chest. Then gently open your knees to the sides. This stretches the lower back and releases pelvic tension. Hold each stretch for 30 to 60 seconds. Breathe deeply. Don't push too hard, just enough to feel a gentle release. Why this works? Many men are shocked to find that these simple movements can bring more relief than years of medication. You don't need fancy equipment. You don't need a gym. You just need consistency. Try doing these stretches once or twice a day, especially in the evening before bed. It may help reduce nighttime urination, relieve pelvic pressure, and even improve your sleep. In the next and final section, we'll wrap everything together with a simple step-by-step plan to start healing your prostate naturally. Final summary and natural prostate healing plan. We've covered a lot, from the biology behind BPH, to the role of hormones like DHT, to the power of vitamin D and natural supplements, and even how tight muscles can mimic prostate problems. Now it's time to bring it all together. Let's build a simple step-by-step action plan, so you know exactly what to do next. Step 1. Get your vitamin D levels checked. This is the foundation. Vitamin D is critical for hormone balance, immune support, and inflammation control. Ask your doctor for a simple blood test. The ideal range is between 40 and 60 nanograms per milliliter. If you're low, start supplementing. Begin with 2000 IU per day, taken with food that contains healthy fats. After 2 to 3 months, recheck your levels. Some men may need 5000 IU daily to reach optimal levels, but always adjust based on blood work. Step 2. Clean up your diet. Inflammation starts in the gut, and what you eat plays a huge role in prostate health. Avoid refined sugar, processed foods, fried or greasy meals. Instead, focus on leafy greens, colorful vegetables, healthy fats like olive oil, nuts, and avocados, lean protein like fish and beans. Drink more water. Cut back on caffeine, especially after dinner. These small changes reduce stress on your urinary system and support your body's natural healing. Step 3. Add natural supplements. If your symptoms are persistent, consider adding a targeted prostate formula. Look for a blend that includes beta-sitosterol, saw palmetto, pygeum, possibly ryegrass or vitamin C. These work together to reduce inflammation, support hormone balance, and improve urinary flow. Take them consistently for at least 4 to 8 weeks before evaluating progress. Step 4. Stretch and strengthen the pelvic floor. Daily stretching can bring dramatic results, especially if your symptoms are caused or worsened by CPPS. Start with frog stretch, butterfly stretch, knee to chest opener. Do these once or twice per day. Hold each position for 30 to 60 seconds. Breathe deeply. Relax your muscles. Within just a few weeks, you may notice better urine flow, fewer nighttime bathroom trips, less pelvic pressure, and even improved sexual performance. Step 5. Change the way you sit and move. If you sit for long hours, change it. Stand up every 30 to 60 minutes. Adjust your chair for better posture. Use a cushion if needed. If you ride a bike, consider a wider seat to reduce pressure on the prostate. Incorporate gentle walks or stretching breaks throughout your day. Movement heals. Stillness leads to stagnation. Step 6. Sleep more. Stress less. Lack of sleep and chronic stress both elevate inflammation, which can aggravate BPH symptoms. Aim for 7 to 8 hours of restful sleep per night. Try deep breathing, meditation, or light reading before bed. Keep your bedroom cool, dark, and quiet. Give your body time to repair. That's when the real healing happens. Final thoughts. You don't have to live with the discomfort of BPH forever. You don't have to rely only on medications. And you're not alone. With small, consistent steps, you can shrink your prostate naturally, relieve symptoms, and get back to living the life you deserve. Start with one change today, then build from there. Your body knows how to heal. You just need to give it the right tools. Thank you for watching. If this video helped you, please share it with someone who needs it. And as always, make it a great day.